Today I'd like to talk about asthma. Over 5 million people suffer from asthma in the UK. Around 1 million children and 4 million adults. The UK has one of the worst asthma death rates in Europe. So it's really important that we understand what it is, what we can do to prevent it, and what treatment you can have. This video might just save your life or one of your family or friends. So please watch the whole video through. Asthma is a lifelong condition, and most people who have it will always have asthma. However, many people have it as a child and literally grow out of it. It goes away. It can sometimes come back though with hormone changes such as pregnancy and menopause. So what exactly is asthma? Well, it's a condition that affects your airways, the small tubes that carry air in and out of the lungs. The symptoms are usually coughing, wheezing, and shortness of breath, plus chest tightness and pain, and all of this can lead to trouble with sleeping that can also end up exhausting you. These symptoms are often made worse by a respiratory virus, a cold, or flu. And ultimately, a person may end up having an asthma attack, which can lead to a very serious situation. If you have asthma, you need to be aware of what triggers your symptoms and makes things worse. A trigger irritates your airways. So what are the possible triggers? Well, firstly, the weather. A sudden change in temperature, for example, going from hot to cold, can cause a trigger. Secondly, a chest infection. You're also more prone to chest infections if you do have asthma. And the difference between an asthma cough and a chest infection cough is mainly that the asthma cough tends to be dry, whereas the chest infection cough tends to be wet. Number 3 is food. It is quite rare, however, but a certain amount of people with asthma are triggered by certain foods. This is because they can be allergic or sensitive to certain foods. An increase in asthma symptoms is not to be confused with a food intolerance. Food intolerance tends to cause stomachache and bloating for some time after eating, whereas you typically have a quick increase in your asthma symptoms if it was a food trigger. So you need to be aware of the foods that you're allergic to and then avoid them. And some of the most common foods are gluten, such as wheat and cereal products, shellfish, peanuts, eggs, milk, seeds and soya. Also be careful of preservatives and processed meats and alcohol. A fourth trigger is the air quality, especially indoors. Damp and mould, pets, cigarette smoke and dust mites. So keep your windows open, just be also careful of high pollen or high pollution days. Regularly wash your bed sheets and don't smoke. Be careful of pollution outside as well, like barbecues and bonfires, especially as the smoke can irritate the airways. A fifth trigger is stress and high emotions and low mood and depression. And even laughter can trigger you. Cause as it affects the way we actually breathe. Breathing less regularly or panicky breathing tends to be taking shorter breaths through your mouth. And irregular mouth breathing can trigger asthma symptoms, as the air is not warmed, which it normally would be, by passing through your nose first and then through your mouth on the way out. So consider breathing through your nose rather than through your mouth so the air is not so dry and cold. A sixth trigger is exercise. This will help asthma, definitely, but it can also sometimes cause a slight increase in your symptoms, especially when your heart rate goes up and you tend to breathe through your mouth again rather than through your nose. And again, the air is cold and dry coming through your mouth. So be conscious of your breathing technique when you exercise. Breathe in through your nose and out through your mouth. And make sure whoever is training with you, that they know that you've got asthma. Exercising indoors during the winter and warming up and cooling down steadily will also help a great deal if you have asthma with exercise. So what are the best preventers and treatments for asthma? Well, first of all, medicines. You can use a preventer inhaler, which is normally brown coloured, and this helps stop symptoms occurring in the first place. The brown inhalers contain a low dose of steroids that help reduce the sensitivity of your airways. And if used regularly, it should also decrease the chance of asthma attacks by building up a resistance to the actual triggers. And also you can take a reliever inhaler, which is usually blue coloured. This gets the medicine directly to your lungs and quickly relaxes the muscles surrounding your airways. The airways can then open up more widely, which makes it easier to breathe again. This actually should take effect fairly quickly, within literally a few minutes. Also, exercise and breathing techniques can help a great deal. Exercise will decrease inflammation in the airways and improve your general lung function. It's believed that asthmatics tend to breathe faster than other people, and many have a tendency to be mouth breathers. This exposes the lungs to cooler and drier air, which again is an asthma trigger. Therefore, by changing your breathing technique to breathing in through your nose and then out through your mouth, and repeating this will actually then reduce your asthma symptoms. And this actually may eliminate the need sometimes of even taking a preventer inhaler. But of course, if in doubt, take the inhaler. Always keep it with you when exercising, and generally keep it with you. Don't take any unnecessary chances. Also consider, if you do, stopping smoking. Basically, smoking irritates the airways, making them swollen, narrow, and filled with sticky mucus. And often this will cause an asthma trigger and perhaps even an asthma attack. And it can be very hard to control this, even with medicine, if you smoke. Other considerations that can actually help asthma, well, vitamin D. Research shows that if you have asthma and have low levels of vitamin D, then you will actually reduce your risk of having an asthma attack by taking a vitamin D supplement. Ginger can relax the airways, so consider taking a ginger shot. One last point is that what can you do if you're faced with somebody with asthma and they don't have an inhaler at hand with them? What can you do? Well, first of all, you can stop whatever you're doing and sit the body upright. Secondly, stay calm. Thirdly, take long, deep breaths in through your nose and out through your mouth. Get away from anything that's triggering the asthma symptoms. Take a hot, caffeinated drink. And of course, seek medical advice immediately. So always consider consulting your doctor anyway for individual and further general advice. So there we have it, all about asthma. If you suffer with asthma and in any way at all, or believe that you may be, as I said earlier, always consult your doctor, who will set you out an individual action plan. And although there is no cure actually for asthma, by taking advice and following through, in nearly every case, the symptoms can be much improved and managed.